Hello there. Welcome to Pediatric Doctor at Home, brought to you by a board certified pediatrician giving practical medical tips to parents and caregivers of children and young adults. This video is about chronic constipation. Is your child struggling with stubborn constipation that just won't go away? Let's dive into 5 factors that might be causing this and explore simple solutions that can make a real difference. Constipation is a common problem among children, but for some kids, it can continue for weeks or even months, causing discomfort and frustration for both the child and their parents. While occasional constipation is usually not a cause for concern, chronic constipation can be more complicated and recovery usually takes time. Generally, constipation in children is defined as having less than 3 bowel movements per week or experiencing hard, dry, and difficult to pass large stools. Constipation varies in severity, and for some children, it can become chronic, meaning that symptoms last for 3 months or more. When constipation persists, it can lead to other problems like accidental soiling due to impacted stool, painful tears around the anus, and anxiety surrounding stooling. But what causes constipation to become a long-term problem in children? There are several reasons for this, ranging from dietary habits to psychological factors. Understanding these causes can help parents and healthcare providers better manage the condition. Fortunately, there are effective remedies for managing persistent constipation in children. So let's unpack this. Dietary factors. One of the most common causes of persistent constipation in children is a poor diet. Many children consume inadequate diets that are low in fiber and high in processed foods, which can slow down digestion and make it difficult for the body to pass stool. While processed foods may be more convenient, make an effort to provide your children with nutritious, fiber-rich options to support their health. Fiber is essential because it helps add bulk to the stool, making it softer and easier to pass. Changes in the diet can also contribute to constipation. For example, infants transitioning from breast milk or formula to solid foods, introducing cow's milk in an infant's diet, or increasing the quantity of milk consumed can sometimes lead to constipation. Additionally, adequate water intake is essential for preventing and treating constipation. Dehydration makes it tougher for the large intestine to soften stool, resulting in hard, dry bowel movements. Children who drink sugary drinks like soda or juice instead of water may be more likely to experience constipation. In terms of remedy, one of the most effective ways to address constipation is by increasing fiber intake. Foods that are high in fiber, such as fruits, vegetables, whole grains, and legumes, can help soften stools and promote regular bowel movements. There is a video on this channel that focuses on the best foods for children with constipation. The link will be in the description box below. Parents can encourage their children to eat more fiber-rich foods by making small, gradual changes to their meals and snacks. Let it be a fun and consistent part of daily meals and set a positive example by eating fiber-rich foods yourself. If possible, involve children in grocery shopping, allowing them to pick colorful fruits, vegetables, and whole grains. Gradually introduce new foods to avoid overwhelming them and praise them even for small efforts. Encourage your child to drink water throughout the day and limit sugary drinks. Toilet training issues and stool withholding behavior. This is significant as holding in stool can become a habit that leads to chronic constipation. Some children develop anxiety around the toilet, especially during the potty training phase. Fear of pain from previous difficult or painful bowel movements can cause a child to intentionally withhold stool. When a child holds in the stool for too long, it stays in the large intestine where more water is absorbed, and this makes the stool harder, drier, and more painful to pass. And so a vicious cycle is created where the child continues to avoid going to the bathroom out of fear, worsening the constipation. The goal is to break this cycle, which is especially important in young children learning to use the potty. Constipation also often happens during the transition to school. This is because children may be reluctant or feel embarrassed to use the toilet at school, or because the change in schedule interferes with toileting. These challenges can be addressed through various strategies. During toilet training, establish regular toilet habits. Encourage a child to sit on the toilet around the same time each day, preferably after meals when the body's natural reflex to have a bowel movement is strongest. This helps train the body to develop a routine. It is important that the child feels comfortable and not rushed. Creating a calm and supportive environment around bathroom use, especially during toilet training, can help alleviate fear or anxiety. For toddlers with constipation, it is better to hold off potty training until it no longer hurts to go to the bathroom. In more severe cases, parents might need help from the school and teacher. Some kids may benefit from using a private bathroom, and the teacher should be aware of the child's needs, allowing them to go to the bathroom as needed. It may also help to have a change of clothes on hand in case of an accident. Lack of physical activity. Physical activity plays a huge role in maintaining a healthy digestive system. Children who lead sedentary lifestyles or spend too much time sitting, for example, watching television or playing video games, may be more likely to experience constipation. Exercise helps stimulate the muscles in the intestines, which aids in moving food through the digestive system. A lack of movement can slow down digestion, leading to persistent constipation. Encourage a child to stay active, as this can help stimulate their digestive system. Simple activities like walking, running, or playing outside can have a significant impact on improving digestion, regular bowel movements, and promoting better overall health. Emotional stress. Believe it or not, stress and emotional factors can also play a major role in persistent constipation. The gut and brain are closely linked. When a child feels stressed, the body releases stress hormones like cortisol, which can slow down digestion and lead to constipation. Major life changes, such as moving into a new home, starting a new school, or the arrival of a new sibling, can cause anxiety or worry that can trigger physical symptoms, including changes in bowel habits. Try to find out when the constipation first started and if it might be related to a specific event or change. If you find out that stress or anxiety is contributing to your child's constipation, it is important to address these emotional factors, as it can be crucial in managing long-term constipation. Talking to your child about their feelings or seeking the help of a counselor can also be beneficial in cases where emotional stress is contributing to the issue. Medical conditions and medications. In some cases, persistent constipation may be a result of an underlying medical condition like hypothyroidism, celiac disease, or irritable bowel syndrome. Additionally, certain medications such as antihistamines, antidepressants, or iron supplements may contribute to constipation as a side effect. If constipation persists despite dietary and lifestyle changes, consult a doctor to rule out any serious medical condition. Over-the-counter laxatives or stool softeners may be recommended by a doctor. These can help soften the stool and make it easier for the child to have regular bowel movements. However, laxatives should only be used under medical supervision, as overuse can lead to dependency or worsen constipation over time. To summarize, persistent constipation in children can be caused by a variety of factors, including diet, behavioral habits, emotional stress, and medical issues. By understanding these causes and taking proactive steps to address them, parents can help their children change long-term habits and find relief from chronic constipation. Remember to remove negative judgments. For instance, when a child has accidents due to constipation, it is not because they are being rebellious, but it is actually a physical problem where they lose control. So the child should not be scolded or punished for these accidents. Also know that regardless of the causes, medications for constipation called laxatives are often necessary and are safe for long-term use. The process of recovery from chronic constipation does not happen overnight. It can take months and even years for some kids. Overall, the majority of kids improve with appropriate treatment, even though setbacks are quite common. So, work closely with your child's doctor to ensure that your child's digestive health is on the right track. Would you like more ideas for keeping your kids healthy? Like this video and subscribe for expert parenting tips. Don't forget to share with your friends too. Thank you very much for watching.